Our demonstration follows Angela Davis, a 52-year-old female with diabetes, hypertension, and rheumatoid arthritis, as she moves from different states between different EMR vendors, and we will follow 5 different vendors of the SureScripts Network Alliance who use the nationwide SureScripts Health Information Network to seamlessly share data between their systems. This critical information helps the provider make informed treatment decisions, as well as communicate with Angela to save her money on the cost of her medications. The different type of standards that you will hear us talk about today are standards such as NCPDP, HL7, CDA, FHIR, as well as IHE and direct messaging. We're going to start today in Shakopee, Minnesota, where Angela is seeing her primary care provider to check in on her diabetes and rheumatoid arthritis.
Hi, so as Angela comes into the exam room today for a regular scheduled appointment, in the Cerner EMR, we're able to go out to the SureScripts network and query real time for that external medication history. And pulling the external medication history into the chart for Angela, we're able to engage the patient, review her medication, and then talk to her about her symptoms for today. And she's coming in and she's talking about how she has some high blood sugars as of late. They're running in the 160s. She's been trying to control her diet. However, she's been unable to lose weight. So as engaging the patient, reviewing the information that we're able to go out and query SureScripts and pull back into the EMR. We go ahead and make a decision to adjust Angela's medical regimen today, and we're going to make her prescribe a medication of Januvia to help her control her condition. So as we write the prescription and pull that into the workflow, the real-time price transparency capability with the integration with SureScripts, going out and pulling that information from her pharmacy benefit manager, checking her eligibility, and also checking the price of that drug, it pulls it into view here. So it also displays a lower cost alternative in the workflow face up, so you can engage the patient in conversation and give her the option and give her the awareness that she's also eligible for a alternative medication that's about 50% cost. So this is where the value comes into play with being able to engage the patient, being able to provide for our lower cost alternative, leveraging the SureScripts integration. So we are going to go ahead and select that alternative medication, which is saving her about 50% out of pocket for the day. Once we bring that into view, and prior to writing that prescription and signing and sending it out, we're also prompted with an electronic prior authorization requirement based on her pharmacy benefit manager's requirements and her eligibility and her plan. So as part of the integration with SureScripts, what that does is previous methods and requiring electronic prior authorization information, there were legacy methods such as paper, phone calls, things to get that information accommodated, which inserted 3 to 4 days. There was a lot of delay in the process. This is now all built in, upfront, real time, so that is triggered and sent off once you write the prescription. So we will write that prescription, trigger the electronic prior authorization, save Angela some money, and then we will go ahead and discharge her and send her on her way. When we discharge, the clinical document from her encounter containing all of her structured and unstructured data and discrete data, some of the narrative clinical notes will be freed up, and it will be able to move with Angela throughout the care continuum via national exchanges for query, using a query method and pulling it into the workflow, or we can push that to endpoints using direct messaging.
So a few months go by and Angela gets a new job that requires her to move across country from Minnesota to Virginia. With that move comes a change in insurance, as well as the need to get a new primary care provider. As she's acclimating to her new life, her new job, she's starting to experience some increased swelling and tenderness in her joints, as well as a little bit of chest discomfort. She scheduled a new appointment with a new primary care provider, Dr. Roberts, who uses the eClinicalWorks system.
Hi, I'm Vikram from eClinicalWorks. So today I'm going to be playing the role of Dr. Roberts, who's using eClinicalWorks EMR. So Angela Davis is in my clinic complaining of tenderness and swelling in joints and chest pain. My staff is helping her with the check-in process. As a part of the check-in process, the first thing they do is to capture the consent of Angela Davis. By doing so, they are authorized now to exchange our information via the network. On the additional information screen, the send and receive checkboxes are checked, which means that now Angela Davis information can be sent and received via the network. Once this is done, they go to the visit status screen, and mark the status as arrived. By doing so, what this does is it tells the ECW system that it can go ahead and send out a query to SureScripts NRLS, which is the National Record Location Service. This comprises of 3 steps: the XCPD call, which is the cross-community patient discovery call, wherein the ECW system uses Angela's demographics to send out to SureScripts using IHE standards. Since this is a standard document, they are able to consume this document, find a match for Angela, and return with a patient identifier. Now, ECW uses the patient identifier to follow up with the next 2 steps, which is an XCA query and XCA retrieve, cross-community access query and retrieve call to list and fetch the documents. Now, I'm about to see Angela for her symptoms. I go ahead and launch the progress notes. And I can see that the 2 documents have been fetched using the SureScripts network. I launch the Prisma module. And in the records view, I see there are 2 entries for Angela Davis. One from Dr. Roberts using her old PCP using the Cerner system. I would like to review this CCD, the continuity of care document. And I do see that in the problem section, she's had a history of diabetes, rheumatoid arthritis, and hypertension. I can also review the document in a timeline view. Looking at SureScripts location summary document, which is a consolidated document of all her care center visits across the nation, I also come to know that she's had a visit to an ophthalmologist. Since she's had a history of diabetes and it's related to a retinal scan, I would love to review the CCD. But while as a part of the query, we didn't get the CCD back from SureScripts. So probably the practice are not part of the care quality. So we'll have to call them and have them fax me the documents the old-fashioned way. So now that I've reviewed the documents, since this is a standard CCD document using HL7 standards, we are able to parse these documents discretely, and they are available on the right chart panel. And we can import it to the progress note to do reconciliation. I go to the treatment plan section to come up with the treatment plan for Angela Davis. I see that despite her higher dose of methotrexate, her symptoms have progressed. I'll have to send out a referral to Dr. Evans. And for her prolonged chest pain, I want to refer her to a cardiologist. So I go ahead and I send a referral from the referral screen. So I add the required attachments, the CCD documents, and I hit the send referral. What's this going to do is it's going to basically send out a message, the CCDs, as an attachments using direct protocol to the cardiologist, Dr. Hassan, using the NextGen system, and Dr. Evans, the rheumatologist, using the Prima system. Now, I'm also going to assign her a care manager that can also be viewed in the right chart panel. All right, back to Kelly.
At the close of the visit, the care manager helps Angela schedule her referral to the cardiologist as well as the rheumatologist. She also enrolls Angela in the SureScripts clinical notifications program. So if Angela presents for care outside of Dr. Roberts' practice, they'll get an alert indicating that she's receiving treatment elsewhere. They're able to follow up and make sure Angela is getting the appropriate care. A few days later, Angela presents for her scheduled visit at the cardiologist, and Dr. Hassan uses the NextGen system.
Good morning. My name is Dan Werlin with NextGen, and I'll be playing the role of Dr. Hassan, the cardiologist. So after the referral, Angela will show up at the clinic, and we're able to review that referral. So specifically, we can see the progress note, which lists the reason for the appointment, details from the examination that she had with her primary care physician, and any other details that they'd like to share. In addition to that unstructured document with details of the referral that came to us using the direct protocol, we also get a structured document, a CCDA, which has a wealth of additional clinical information, both present and from her past, with details about medication, demographics, problems, immunizations, and the like. And because this is a structured standards-based document, we're able to retrieve a great deal of this information directly into our chart. We can compare it against information that we already have, identifying pieces of information that we do already have, unique information, and potential conflicts or warnings that require further investigation. In NextGen and in many other systems, you're able to import this directly into the chart, avoiding the need for data entry, for duplication, and for typos. After having reviewed this and retrieved the information that we desire, we're also going to check on care quality. So the National Care Quality Network, specifically powered by the SureScripts RLE, will enable us to see if there are any other clinical organizations out there that have relevant documentation for Angela. In this case, I can see specifically that there is a document from Cerner from back before she moved to Arlington. And this, again, is a CCDA with all the features that I mentioned relating to the document from ECW. So again, I can review the data here, determine how it might impact my plan of care, and also which information I didn't already have and I'd like to retrieve into her chart. After having done all of this review, I can now proceed with the actual encounter. So I'm going to skip over many of the steps that you would normally take so I can focus on interoperability. Angela came because she was experiencing chest pain, so we're going to prescribe a stress test, which we'll do at the office. After prescribing the stress test, the results come back and they're negative, and all this will be recorded in the chart. We also noticed regarding Angela that her blood pressure is uncontrolled, so we're going to prescribe a medication. Initially, the interest is in prescribing a medication called Mycardis. However, through our connection to the SureScripts pharmacy, to the pharmacy benefit connection, we are able to determine, based on her particular plan and insurance, the cost, what medications are available, and what the likely costs are. Because the price of this particular medication is a little bit higher than Angela would like to see, again, using our connection to SureScripts, we're able to see what other biosimilars may be out there that can provide a similar treatment but at a different price point. So we identify another medication called losartan, and Dr. Hassan, in conversation with Angela, determines that that would be an appropriate medication to prescribe. So we replaced the initial prescription of Mycardis with losartan for substantial cost savings. And then we e-prescribe it, and it will go to her pharmacy through the SureScripts network, so Angela's able to pick it up at a time of her choosing. The encounter is now done. Angela goes home, but all this information is in our chart, and all this information will now be available to other partners in Angela's care, so they'll be able to retrieve the data in much the same way that I was able to retrieve it from the Cerner system and from the ECW system.
The care manager had helped Angela schedule her visit to the rheumatologist a couple weeks later, so she presents to Dr. Evans to check in on her increased swelling and tenderness.
Hi, my name is David Wiegand. I'm with Aprima, an EMB's company. Angela arrives at Dr. Evans' office, and the first step is always going to be verifying demographic information. As they go in and verify demographic information, they're going to make sure that they get consent to download medication history for Angela, as well as enrolled Angela in SureScripts Record Locator Exchange. As they've done this through a nightly process, we automatically download medication history and eligibility for each patient. In this scenario, I'm going to go ahead and do it in real time by downloading the benefits for Angela and bringing them into the Aprima EMR. As I go in and select this process, I'm going to be downloading this information. The staff is then going to go in and review patient history with Angela. And as they go through and review the patient history, when they get to the medication history section, they'll be able to access the information that was downloaded from the SureScripts and pharmacy benefit managers, selecting the appropriate medications and adding them to the patient's history. Once all the medications have been reconciled and all of the demographic information has been verified, the patient is now ready for Dr. Evans to see. As the patient is now ready for Dr. Evans sees that he has received a direct message from Dr. Roberts' office earlier, as this is a referral. So he's going to go in and review this direct message. This does come in as a standard CDA document. And because this is a structured standard document, we'll have the capability of reviewing the information as well as importing medications, allergies, and problems directly into the EMR. We also have received an unstructured document through a progress note, and I'd be able to review this document as well in a PDF format. This way, I truly understand all the care that's happened with the patient. As the documentation has been reviewed, Dr. Evans is ready to start his visit. So as I start my progress note and go in, I start talking to Angela, and she informs me that she just recently moved to the Virginia area. Because of this, I want to make sure that I truly have all the information that's been going on with Angela. So I'm going to be accessing the SureScripts Record Locator Exchange. And when I do this, we're actually using FHIR standards HL7, sending it to SureScripts. SureScripts is converting this to IHE standards, and then when they retrieve back, they convert it back to FHIR, and we get that back into Aprima. As we see, there are several documents that are available to download into my system from various different vendors such as Cerner, eClinicalWorks, and NextGen, so now I have a complete understanding of the care of the patient. As I download and import these into my patient's chart, I will be able to view those and decide what course of action I want to take. If they will come in as a standard CDA document as well, because again, these are structured documents. I have the capability of importing allergies, medications, and problems to make sure that my patient's history is accurately documented. Now that I truly fully understand all the care that's happened with Angela, I'm going to go ahead and start documenting a standard joint complaint visit. I've created a template to ease the doctor's time in documenting. So I'm going to select my appropriate joint complaint template, and therefore it completes all the various tabs, and I can chart by exception instead of the rule. As I go through and I document, I'm going to come in and I'm decided to change her medication from methotrexate that she's been using for the last 4 years to Humira. So I'm going to go ahead and prescribe this medication. As I come in and prescribe this medication, because this is a specialty medication, we've automatically triggered the system to send out a specialty patient enrollment to SureScripts so that we can get the necessary forms from the pharmacy back into our system to approve this specialty med. We also download in real time the formulary information, and we can then review this with the patient. The importance of this is we now know how much a 90-day supply of this medication is going to cost, and we can talk about alternatives if that is appropriate. At this point, I am going to go ahead and prescribe Humira for Angela, and this, because of the pharmacy benefit information from the formulary, it also triggered that this requires a prior authorization. So I'm going to go ahead and send that prior authorization out electronically through the SureScript network as well. So I'm going to go ahead and save and prescribe this medication for Angela. As I prescribe this medication, I'm going to review through all the rest of the notes and verify that I have everything correct. As this note is now complete, I'm going to go ahead and mark it as complete for Angela, but my work is not done. Now that Dr. Evans is finished with Angela, we still have that electronic prior authorization complete as well as the specialty patient enrollment forms. So I'm going to access the SureScripts Accelerator through the EMR that will allow me access to the task list to work these messages. As I can see, I have the specialty patient enrollment form here, and I'm going to go ahead and select this to start working. When this enrollment form comes up, I'll be able to select the exact form that I'm using to complete. In this case, it's going to be a rheumatoid arthritis form. And I'm going to start enrollment. The other reason why this is very important, it comes in electronically into the EMR, is that I automatically can download pertinent information from the EMR directly into the form, such as medications, allergies, and problems. And I can go through and complete the various steps that is required for this form and submit it from my EMR directly to the specialty pharmacy, getting it approved that much quicker, and also having the medications possibly sent to the office or directly to the patient's home. This medication also did require an electronic prior authorization, so the pharmacy benefit manager has sent back through SureScripts the required necessary electronic prior authorizations to be completed as well. So I will select that. And in here, I will go through the various steps to complete the prior authorization to make sure that this medication is truly approved by the pharmacy benefit manager before, so that I can let Angela know that she is going to be able to receive and fill this medication.
So once the prescription and the enrollment forms are sent to the specialty pharmacy, the pharmacist immediately and electronically has all that information necessary to quickly approve and send Angela her critical treatment plan, her medication. She goes home, and a couple weeks later, she is playing soccer with her niece and her daughter and starts to experience some more chest tightness. Her daughter takes her to the closest emergency room, which uses the Epic EMR system.
When Angela arrives in the emergency room, a couple of things happen automatically in the background. The first of which is a query to SureScripts using the record locator exchange to identify places where Angela has previously been seen. And then subsequently, using that information, we were able to query the EMR sources for the HL7 structured documents containing a continuity of care information for Angela's previous treatment. Additionally, we are also able to query SureScripts for pharmacy benefit information to get Angela's pharmacy coverage, as well as inline C medication history information that pharmacies and pharmacy benefit managers provide back, indicating dispenses at the pharmacies in line with the other EMR documented medications. Knowing that Angela is presenting with chest pain, we want to view some of those outside documents that we've received, particularly from the cardiologist, to see that whether or not the cause of Angela's chest pain is due to any heart condition. So I'm going to open up the document sent to us by Dr. Hassan. When opening it up, I'm able to see that Dr. Hassan did perform a cardiovascular stress test, which came back normal, indicating to us that the root cause of Angela's chest pain is probably not due to a heart condition. Having this information available to us saves Angela and us critical time and money in quickly diagnosing Angela's condition. After further diagnosis and testing, we were able to determine that the root cause of Angela's chest pain is due to reflux. So when we are getting ready to discharge Angela, we will be prescribing her a we'll be prescribing her a reflux prescription. In this case, we'll be prescribing a Dexilant, and then using the real-time prescription benefit functionality, we'll be able to pull down an estimate of how much Angela should expect to pay out of pocket for this medication. When pulling up this estimate, we see that her plan will not cover the Dexilant, but there is a lower cost alternative in the omeprazole that we'll be prescribing instead. After confirming a couple more details with the SIG, we will sign the prescription and send it off to Angela's preferred pharmacy. And upon discharge, we will also be sending an ADT discharge notification to SureScripts so that they can also provide other care providers in the network with the information that Angela has been seen within our emergency department.
So when SureScripts receives in the ADT discharge notification from Epic, we look up in our database and notice that Angela had been enrolled for notifications from her primary care provider, Dr. Roberts, using eClinicalWorks. We're then able to send an ADT notification to Dr. Roberts' staff so that they're able to follow up with Angela and have her come back in and check in on that ED visit.
So back at Dr. Roberts' office, Angela's care manager team, they're able to see that there is a notification in the transition care management module. Since the message that SureScripts sent as an ADT message using an HL7 standard, ECW system is able to parse discretely for information like patient name, date of birth, discharge date, and she was seen by Dr. Wong in the ED department, in the emergency department. So the care manager can also use the screen to create a new follow-up appointment for Angela Davis.
So as you saw throughout the demo, all 5 members of the SureScripts Network Alliance use the SureScripts Nationwide Health Information Network to seamlessly and quickly share information using standards such as NCPDP, HL7, ADT, FHIR, IHE, and DIRECT to share that critical information necessary to help make informed care decisions about Angela, improving her outcomes and getting her the best care at the lowest possible cost.